Hi, this is Dr. Lin with Empowerment Physical Therapy. Today, I am going to teach you one of the foundations that we've instilled into our existing patients as they embark on their recovery journey with us. One of the fundamentals that we like to teach to make sure that their foundation is set. The same way that you build a house, that you make sure the foundation is put in place before you build on top of it. And that we see with a lot of clients that come in, that they instantly want to look for the X factor, that exercise that's going to get them out of this issue. And that often stems from a lack of patience they have. And that when we look at their foundations, it's often unstable and porous. So if you build stuff on top of that, and they don't have a solid understanding or foundation, they tip over. They tip over. And they'll create more problems down the line. So one of the things that we like to teach our patients is to breathe through an exercise and any mobility work or any spot that they're tough to get through or being put in the position of. So for instance, if we're doing deep pressure using a lacrosse ball for a patient of ours, and we put it in a spot where it hurts for them, let's say in the hip, and that's the spot where it hurts. Oftentimes what they'll initially do is once they put pressure on that spot, they'll hold that breath because of the pain. And they do it reflexively without even thinking about it. It's what we do when we're in pain and you're putting pressure on that pain. The first thing we do is to gasp for air and hold that breath and hope that pain will go away. And when you do that, it creates tension in that part of the body, where now that exercise is doing more harm than good for you. So you've got to be able to breathe through that pain. Put an adequate amount of pressure in there that's tolerable for you. In the case of that example of the lacrosse ball in your hips, put an adequate amount of pressure that you can tolerate. Once you know once you've kind of put the pressure on, breathe through it as if you're blowing out a candle. And don't look at that spot, but look far away and find something to distract yourself. Because the moment you look away and you're putting pressure on your hip, guess what? It's a distraction for your brain. And it takes the pain down just a notch when you look far away and not at the hip that you're working on. And it's an instant change if you think about it. So the takeaway is to breathe through it as you're putting pressure through it, or you're being put in a stretch that's tough for you, where you're being put in a position that you're not comfortable in. The first thing you're going to do is want to hold you're going to try to hold your breath. The same thing. It's no different than an exercise that you're having a hard time with. So breath work is a crucial element in addition to the exercise. To make sure that you get the best benefit out of that exercise, we need to make sure that you're breathing through it as opposed to holding it, because that makes the biggest change between an exercise that's going to help you as opposed to an exercise that's going to hurt you. Same exercise. It has the ability to do both things. That's why some people get better. Some people don't, even though they are doing the same exercise, because they don't understand what they need to do to get to the next part and to make that exercise be beneficial to them as opposed to be harmful to them.